In the old days, a hearing aid was just magnification. So it increased the noise in the background and the noise of the person talking with you. How have they differentiated that? What have they done that makes the hearing aids more sophisticated?
Sure. So the interesting thing about hearing aids is that they're kind of marketed on all different ways. So if you went to Amazon.com right now, you can buy what's marketed as a hearing aid that is basically just a sound amplifier. It's a little microphone and it'll just increase the volume of everything around you. Probably there are some people that that'll be a really good option for, but the vast majority of people's hearing loss is a little more complex than that. And so what a good audiologist does, again, not myself, but a good audiologist will do is they'll take the patient's hearing loss pattern and they'll look at it and they'll say, okay, you're kind of struggling at this frequency, but you're pretty good on this frequency. And so they will program the hearing aids specifically to amplify where you are weak.
So it's getting more and more sophisticated.
It is. And there's more and more patient control now. So a lot of them are integrated with apps. And so you might have an app on your phone that says, now I'm at dinner, and the algorithm or the program, that the software that's in the hearing aid will change so that it will now amplify the person right across the table from you rather than all the surrounding noise.
I've got a person that sits beside me in choir, and he pulls out his cell phone, and I don't know if he's trying to make it where he hears the preacher more or he hears him less.
That's right.
So they have the ability to control different environments with hearing aids like that. How big are hearing aids? Do they fit in the canal or do they hook onto the bone?
So there's different styles of hearing aids. The most kind of universal style, and the style that the majority of our patients end up in, is what's called receiver in the canal, where they have a little piece that's in their ear canal and then they have a tiny tube that's clear. So it almost just looks like a little thin hair that goes up and around, and then the majority of the processing parts of the hearing aid sit behind the ear itself. And so it's something that, honestly, I'll see patients all the time and I won't realize until I go to do the ear exam that they're wearing a hearing aid. It's very, very subtle.
Yeah, to me that's cool. When the audiologist and the ear, nose, and throat doctor makes a decision on the hearing aids and they decide what's best for the patient, how important is follow-up?
Very important. And again, that's where a good audiology team is invaluable, because I see patients all the time and they say, hey, my hearing aid's broken, will you fix it? And I am clueless. That is not my specialty. But luckily we have a really good team of audiologists, and I will say, let me kindly show you to the person that can help you with that, because a hearing aid is not the same as a pair of glasses. You know, you get your glasses, they're the right prescription, they're a good fit. You can use them for a while and they don't require a lot of messing with. A hearing aid is a little bit more of a complex instrument. It has a lot of different features and a lot of areas that can work well or not work well. And so close follow-up with somebody that's good at programming a hearing aid is essential to get a good result.